Boa tarde a todos, sejam bem-vindos a esse evento do Conselho Federal de Educação Física. Nós estamos num momento único, peculiar. Nós somos da Câmara de Atividade Física e Saúde do CONFEF. Eu sou o professor Gilmar Pereira, no momento respondo como presidente. Nós teremos 2 dias, hoje e amanhã, 2 tardes, de eventos da Câmara. Temos outras câmaras também do CONFEF que estarão trabalhando amanhã pela manhã. Serão 5 câmaras pela manhã, 5 câmaras à tarde, com diversos assuntos relacionados à nossa categoria. Teremos hoje à tarde um primeiro evento, uma primeira palestra, uma palestra internacional, que será conduzida pelo Dr. David Nieman. Dr. Nieman é uma referência internacional, talvez a maior autoridade para discutir exercício, atividade física e saúde. Dr. Nieman teve um protagonismo muito grande, sobretudo por conta da pandemia do Covid. Entretanto, para quem está há mais de 10, 15 anos na área, o Dr. Nieman tem obras que foram as referências na formação dos nossos acadêmicos. Não há qualquer dúvida, não há qualquer questionamento em relação à sua autoridade acadêmica, à sua autoridade científica, e, com certeza, ele veio a influenciar muitos de nós, profissionais de educação física. Vai ser uma honra. Nós teremos um primeiro momento com uma palestra, uma leitura do Dr. Nieman, falando do link entre a atividade física e sistema imunológico. E, na sequência, a gente vai ter a honra, o prazer de contar com ele remotamente, algo que a tecnologia nos permite hoje, o que será possível a todos os profissionais que estão online, que estão nos acompanhando, interagir com essa referência do exercício físico. Fiquem agora com a palestra do Dr. David Nieman.
Hello, my name is David Nieman, and I would like to talk to you today about the compelling link between exercise and our body's defense system. So I started looking at the relationship between exercise and the immune system way back in the 1980s, and I worked with a stress immunologist, Dr. Sandra Nielsen Canarella. She was the investigator who transplanted with surgeons a heart from a baboon into a baby. And the baby survived for a while afterwards, but then did not make it. But this was the first attempt to transplant something from a baboon into a human to help take care of a genetic defect. So Sandra was the immunologist during this operation, and we teamed together and started looking at exercise and its effects on the immune system. She was very interested in this area because of the stress that is involved with vigorous exercise. So we started this in 1983. We are now 40 years past that experience. What have we learned during the past 40 years in this field? Let me summarize the primary findings today. So this is a figure. Notice that on the left side, this continuum has sedentary, and then we go up the exercise workload continuum to an overload training program. So if we look at how the immune system responds, it responds in a positive fashion to moderate exercise, a somewhat negative transient fashion to heavy exertion, but if you overtrain, it can be a prolonged negative response. At the same time, if you look at the illness risk for acute respiratory illnesses like the common cold, influenza, COVID-19, etc., we see that the risk for infectious illness goes down with moderate activity, goes up somewhat with heavy activity, and then can rise quite strongly during an overload training program. So basically, in summary, if you put in 30 to 60 minutes of something like brisk walking on most days of the week, there is a lot of good evidence, both in animal and humans, that the overall surveillance against pathogens is improved and illness risk for respiratory illnesses goes down. If you do something like a marathon race, we have shown that the odds of getting sick are about 2 to 6 times higher than normal during the 1 to 2 week period after that race event. If a person trains heavily and doesn't allow enough time for recovery, then you can have illness risk go way up and immunity surveillance go down. So in general, as we stated in this review paper, the immune system is very responsive to exercise and reflects the degree of physiological stress imposed by the workload. It really is a subset of stress immunology. Exercise is a form of stress depending on the workload, and the immune system responds accordingly. Another model is the J curve. I formulated this back in the 1980s. And basically, if risk for an upper respiratory tract infection is about at the normal level for a sedentary person, it will go down in groups that engage in near daily brisk walking. But if you engage in ultra endurance events, marathon events, there can be a transient increase in risk for getting sick. The reduction with moderate activity is 40 to 50%, fewer days of illness. The elevation in risk is 2 to 6 times higher after extremely demanding exercise events like a marathon or ultramarathon. So the International Olympic Committee had a consensus group, and they basically embraced this model as applying to most athletes. Now, this is a very important set of papers in 1994 and 2000 by Dr. Bente Peterson and Lori Hoffman-Getz, two of the pioneers in this area. And they did conclude that exercise immune interactions can be viewed as a subset of stress immunology. And they emphasize that many clinical physical stressors like surgery, trauma, burn, sepsis, all of these induce a pattern of hormonal and immunological responses that are very similar to what you find with exercise, especially demanding exercise levels. So the immune system reflects the magnitude of physiological stress experienced by the exerciser. That, in one sentence, pretty much summarizes what we've learned in 40 years. Now, I like what are called lines of evidence. And we're talking now the relationship between exercise and then its effects on the immune system. Especially, we're going to be looking at demanding levels of exercise. And the lines of evidence are, you can look at cell culture studies, animal studies, human case histories, epidemiology, and human trials, this being the strongest evidence. And all of these pretty much support that there is a relationship between how the immune system responds to exercise, and it depends on the amount of stress imposed by the exercise training bout and bouts. We don't have time to cover everything, but let's just look at some of the work in the animal area. So early on, way back in the 1940s, there was a series of studies, some of them with rhesus monkeys. They also looked at many other animal models. And if the animal was exposed to some type of virus, and then the exercise was either before the introduction of the virus or immediately after the introduction of the virus, the animal experienced a more rapid and fatal attack and reduced viral resistance and immunity. This has been shown in many, many different animal studies. Here's one example of a study done by a colleague that I've worked with a lot, Dr. Mark Davis at the University of South Carolina. And he had mice. The green line are the control mice. The blue line is when the mice would run on treadmills for 2.5 to 3 hours. And the red line is when the mice went for 30 minutes of exercise. And what Mark did is he introduced a herpes simplex virus nasally into the mice and then had them exercise either very heavily or moderately, and then looked at the survival rates. The amount of virus that was introduced was quite high, enough to kill the animal. And you can see that when they ran to exhaustion, that the fatality rates were much, or the survival rates, roughly half of the animals died. And then you can see here that the survival rate was much improved in those who did either no exercise at all or exercise moderately. So human case histories can also give us some ideas about how humans handle heavy exertion. I've worked with many athletes who have written to me or called me and explained their case histories. And many of them show that their performance went down suddenly, and very often it was linked to where they were overtraining even while they were sick. And that appeared to be a trigger for them entering kind of a chronic fatigue syndrome-like state for months and even years. And the symptoms that these athletes have reported to me and others is that they just feel tired all the time, their muscles ache, they feel like they have arthritis, it just keeps lasting for months, even years. There's some indication that it may be the EB virus that is reactivated. EB virus is pretty much omnipresent and inside of most humans, and that can get reactivated and then perhaps cause these symptoms. Here is just one example of the many athletes I've worked with. He said, I'm 50 years old, has a hard time feeling good on any run. Everything feels labored. He gets fatigued. He gets sick. He's been a runner since he was 13. Between 2002 and 2007, he went into adventure racing, did a lot of 24-hour plus adventure races in all conditions. At the same time, he had some life events like divorce and issues with children, work issues. His dad passed away. He said, I can't pretend these had no effect on my physical resilience. Do you do any testing or diagnosis that may help identify the issue limiting me? Basically, I told him that you are one of the athletes that I've been working with. We've done many immune measures. You can't really find anything, but all have the same types of symptoms, where you combine hard physical training with a lot of stress in life, and the combination is a 1-2 punch that will put the immune system down and make you feel like you have chronic fatigue. The only solution is long-term moderate activity and rest, and allowing yourself to build back up, and you really need to give up this hard training. And I don't know what happened to this individual. Most of the athletes I work with, when I tell them you need to back away from hard training, they don't want to hear it, and they keep going if they can. Many have to stop. Then we have the epidemiology that also support this relationship. And what we know is that illness risk can be increased when an athlete competes in prolonged and intense race events or goes through repeated cycles of unusually heavy exertion. And then if there's other life stresses. So this was one of the first epidemiological studies conducted by Edith Peters in Cape Town, South Africa, and she looked at people who ran the Two Oceans Marathon in South Africa. A third of them got sick during the 2-week period after the race, compared to 15% of controls who lived with the runners. And so we see that the odds of getting sick were double in the individuals who raced versus their roommates. We followed this up with a huge study of 2,300 runners at the LA Marathon. And what we showed is that about 1 in 7 of the marathoners that ran the race got sick during the week after, compared to marathon runners who didn't run the race, only 2.2%. Using logistic regression, we showed that the odds of getting sick were 5.9 times higher in the runners that ran the race compared to the controls. And then we did a subset analysis, and we looked at this was the acute effect. The acute effect. We also looked at the 2-month period before the race, and those who were training at a high level had double the odds of getting sick compared to those training less. So heavy training or participating in this race event increased the odds of illness. Now, there have been many other studies that have been conducted. So here's the Peters study. Here's the study I just referred to. And then Greg Heath did a study with runners in 1991. And then you can see that as time has gone on, there have been other epidemiological studies looking at the risk of illness with either acute or chronic exercise. And you can see that nearly all of these studies are showing a 2-fold, even up to a 9.9-fold increase in illness risk, depending on what the athlete is going through in regards to their exercise events or race events or training. So the International Olympic Committee and the Track and Field Association have been looking at acute illness surveillance systems, and basically they have taken all of the data together, and they are very big on load management for the athlete, where they say there are both internal, like psychological stress responses, and external load management issues like training and competition workloads. And they are recommending that coaches work with their athletes to control both the internal, external loads and adapt everything to the individual athlete to help them avoid either getting sick or injured. Now, when we look at risk factors for getting sick. As the International Olympic Committee has looked at this and other investigators, we can summarize it as follows. Pathogens are always around us trying to get in. The first barrier is the innate immune system. Some of the viruses will get through, especially if the athlete is going through high stress, travel across time zones, is experiencing mental stress, is engaging in winter competitive events, lack of sleep, poor diet, and low energy intake. And all of those, in addition to poor hygiene and avoiding vaccines, can mean that the viruses can get through the innate immune system, and then the adaptive immune system tries to kick in. And then if it has all of these stresses going on at the same time, the athlete can get sick and suffer an interruption in their training program or their racing program. Now, the human trials in this area, best evidence supports that high stress is linked to innate and adaptive immune dysfunction that can persist for hours up to days during recovery. And let me show you some of this. So what I've done with this graph is put together all of the studies, and here we have adaptive immune outcome measures, innate immune outcome measures like natural killer cell activity, macrophage and granulocyte activity, and inflammation like cytokines. And I'm comparing the literature on if you run a marathon versus if you go walking. You can see that walking has kind of this mild stimulation effect on the immune system that is positive. Notice that both adaptive and innate immunity have a negative response to like running a marathon race with high inflammation. So most investigators support the viewpoint that the immune system reflects the magnitude of the stress experienced by the exerciser. Here I have summarized just one marker of inflammation and immunity, which is IL-6. Notice that most individuals have about a 1.25 picograms per ml level of IL-6 at rest. If you walk, it barely goes up. If you do sports like tennis, back and forth activity, even weightlifting, there's not much of a response. But then as you start to engage in hours of endurance exercise and then compete in competitive events where individuals push themselves to high levels, especially with things like we did a study at the South African 90K Comrades Ultramarathon, the Kona Ironman in Hawaii. You can see that the IL-6 just rises to high levels as if the athlete is sick. And so this is a good marker of the workload intensity and the overall effect on the immune system. And levels can rise very high depending on the intensity and duration of the event. At the Western States 100-mile race, we worked with a large group of runners there. This is the most intense and competitive endurance race in America. You start at Squaw Valley and then run 100 miles or 160 kilometers through the mountains. And we looked at not just IL-6, but we looked at other cytokines as well, most of them which reflect physiological stress. And I've put here 154, the scatter plots of the responses of the runners to going through this race. Notice that, these all down here indicate highly variable responses Most of them are showing quite a degree of stress response with high inflammation, but notice that there are some extreme elevations in some of these cytokines, indicating that there are some individuals who respond to this type of exercise stress in a very negative manner. The levels of these cytokines are very similar to a severe case of COVID-19. Lately, we've been using proteomics to monitor the immune system response. There was an athlete that became the first individual in 2018 to trek across Antarctica without any support. He pulled a heavy sled for 932 miles over a 54-day period. We taught this athlete to take finger prick dried blood spot samples, and he did this weekly during both training and then during the nearly 2-month trek across Antarctica, and then during some weeks of recovery. Basically, what we showed, if we looked at training distress, when this athlete was trekking during the last month across Antarctica, he experienced extremely high levels of stress. Anything above 20 is very, very high stress, and he was up near 40. So he supplied dried blood spot samples to us weekly. We did proteomics, and this is a little bit complicated, but basically the proteomics data, which have been published in 2020, they support that the neutrophils this is a part of the innate immune system. Neutrophil function was greatly suppressed, especially the ability of the neutrophils to engulf and kill bacteria was decreased. The proteomics data showed that especially during the last month of the trek, that the innate immune system was quite dysfunctional, and it incorporated the downturn in function of multiple immune cells that then were captured through proteomics. Now in our lab, what we do is try to use proteomics and metabolomics, genomics, epigenetics to better understand how the entire system of the athlete is responding to in the 1990s in a series of studies supported by the Gatorade Sports Institute. We showed that carbohydrate intake not only supported performance, improved performance 2 to 6%, and kept the blood sugars levels higher and the blood insulin higher, but we also showed that at the same workload, if an athlete was taking about 60 grams of carbohydrate per hour of exercise, that the stress hormone response was strongly reduced, and at the same time, nearly every measure of inflammation was down about 40% on average. So then at the North Carolina Research Campus, where I'm located now since 2008, we especially have been interested in polyphenols and then the multi-omics response, all types of plant products, almonds, bananas, blueberries, mangoes, astaxanthin, which is a carotenoid, and we're attempting to help the athlete find what types of nutrition support will help their immune systems get through the stress of heavy exertion in a better way. And we have shown that when the athlete uses something like blueberries, that the polyphenols, the purple color, the pigments there, the polyphenols with the sugars do dampen the inflammatory oxylipin response and improve the immune protein responses. And I'm going to show you some of those data now. In general, our research during the last 15 years has shown that plant foods, like especially fruits, nuts, support athletic endeavor better than sugar water alone. So here we have somebody cycling for about 2.5 hours. And in the various studies, we have them either acutely take something like bananas or chronically add a cup of blueberries per day for 2 weeks. And then a multi-omics approach, either our most common tools are proteomics and metabolomics. We then look at how the whole body is responding to both the exercise and the nutrition intervention. Now, polyphenols are quite complex. There are thousands of chemicals in plant foods like blueberries or pomegranates or green tea or apples, grapes. And these can be divided into various subclasses, including the phenolics or polyphenols. The polyphenols are further divided into 6 other classes, the most common one being the flavonoids. And then those are divided into 7 additional classes. And we're talking like flavin-threols or anthocyanins from berries. Flavin-threols are like in tea. And then what we've learned over time, and it's taken a while to figure this out, is that these flavonoids and polyphenols pretty much pass through the small intestine with very little absorption. They go to the intestine, the colon, where then the bacteria will break them down into smaller phenolics. For example, if you eat blueberries, and here we have an anthocyanin, a complex molecule is broken down into smaller metabolites that then can escape the colon, get into the portal vein, go to the liver, and out into the circulation, where then they can exert anti-inflammatory and other effects on the immune system. So this is a very intriguing new area of research in exercise and nutrition immunology, and we've been pursuing this vigorously for 15 years. One of the important things is having the right outcome measure, and working with Dr. Qibin Zhang from University of North Carolina, Greensboro. He's an expert in looking at oxylipins. Oxylipins are very important oxidation products that come from these various fatty acids that have double bonds in them that are in our plasma membranes. If you exercise, the fatty acids are released, such as arachidonic acid. Notice all of the double bond groups. And then DHA, EPA, or linoleic acid. These double bonds are acted on by various enzyme groups like LOX and COX or cytochrome P450. These enzyme groups will then transform or oxidize the double bonds. And now this fatty acid has become an oxylipin and becomes a signaling metabolite. And these are upstream regulators of inflammation and are very, very important. And we have found that these are very sensitive to both exercise and nutrition interventions. So the reason they're so important, and typically we can measure about 60, 70 of these at one time in the plasma, is these are released during exercise, and then they have upstream regulation of inflammation, the immune system. They're involved in tissue repair, effects on the cardiovascular and kidney systems, and also have effects on oxidative stress. So they're very, very important. And oxylipins are not stored in the body. They are produced on demand. And therefore, if you exercise, they increase, they stay around for several hours, having regulatory effects, and then go away. And what they do depends on the physiological context. Some are actually anti-inflammatory, many are pro-inflammatory. So in a series of studies, we first showed that many oxylipins go up during exercise. Here, 64 of them that went up after 75 kilometers of cycling. And they don't go up just a little bit. The fold increases are just huge. So then, here's one example of a study. We've done many, but here's one example where we looked at the combined effect of 2 weeks of blueberry ingestion, a cup a day, and then acute banana consumption while they were cycling. And we wanted to see what it would do to the oxylipins. First, we worked with Dr. Colin Kay, who's an expert in measuring the gut-derived phenolics that come after eating blueberries. He showed that 24 blueberry-related metabolites came out of the gut after 2 weeks of eating a cup a day of blueberries. So then we took those 24 metabolites and put them together in one group, and just here we can show you what happened. So we had 4 groups, either a blueberry banana group, a blueberry water group, a placebo banana group, or a placebo water group. And so if you look at the blue lines, those are the 2 groups on blueberries, a cup a day. You can see that these metabolites over 2 weeks in the blood, overnight fasted blood, went up. And then during exercise, the athletes were cycling with these blueberry metabolites in their blood. And then they had to sit in the lab. And then the blueberry group, after an hour and a half, took another cup of blueberries. You can see that their metabolites tended to go up, and then they left the lab 5 hours later and then came back the next morning. And then by then everything is washing out. And then 2 days later, still some metabolites there after 2 days post-exercise. So then we wanted to see if cyclists are exercising with blueberry metabolites in their bodies, what does that do to the inflammatory oxylipin response? So what we did is we grouped 10 of the worst inflammatory oxylipins. These are derived from arachidonic acid and cytochrome P450 enzymatic action. So for 2 weeks, before and after, we looked at the oxylipins. In the resting state, as I said, the oxylipins are barely there. They're only produced on demand, so then we had them come in and cycle 75 kilometers to exhaustion. And look what happened. The red line are the athletes who had no blueberries and only drank water in the overnight fasted state while cycling. Notice how high the oxylipins were an hour and a half after cycling. Those on blueberry and no bananas, notice that there was this very significant reduction. And then those on bananas, carbohydrate, were way down. So carbohydrate during exercise helps, or 2 weeks of eating blueberries a cup a day helps greatly reduce the effect of the post-exercise pro-inflammatory oxylipin response. This is very dramatic. This reduction is as if they took a drug, either bananas or blueberries. And then you can see how quickly the oxylipins are removed. This is 3 hours post-exercise. This is 5 hours, and then the next morning, and then 2 days later. So they are really only there during stressful times, and having blueberries or bananas greatly reduces their levels. And we believe that this means that the athlete will have better long-term metabolic recovery after stressful exercise. Notice, though, that here are the athletes who were taking the blueberries, 31 of them. there was a 14-fold variance in how the metabolite levels went up in their blood. There were low responders, average responders, and high responders. And so this is where precision nutrition will come in the future. It may mean that low responders need 2 cups of blueberries a day for the same response that others receive with 1 cup of blueberries per day. Now, we did another blueberry study looking at people who were relatively untrained in the weight room, and then had them take blueberries for 2 weeks, a cup a day, and then they came in for a 90-minute like weekend warrior bout of exercise. And we wanted to see if eating blueberries helped them recover better from an unaccustomed bout of exercise. First, we looked at the blueberry metabolites in the urine. You can see that over a 19-day period, that the urine contained a lot of blueberry metabolites compared to the placebo group. We then had them in the lab. There were 17 different exercises, split squats, weighted step downs, all of this eccentric activity that was meant to ensure that they got sore with muscle damage, like a weekend warrior bout. We then looked at oxylipins. Now, some of the beneficial oxylipins come from EPA DHA, and these are called SPMs, specialized protein resolving anti-inflammatory markers. These are resolvins, mucins, protectins. These are very strong anti-inflammatory oxylipins that come from EPA DHA. Now, these are not stable in human plasma, so then these intermediates are often looked at, and these are listed here, and these are the precursors. So that's what we looked at, is did blueberry ingestion do anything to those precursors of the specialized pro-resolving lipid mediator, the SPMs. So here's what happened. So that's the placebo group. 2 weeks of taking placebo powder, 90-minute weekend warrior bout, and then 4 days where we monitored their oxylipin responses, looking at these anti-inflammatory oxylipins. And look what happened with the blueberry group. You can see that the blueberries induced an elevation in these anti-inflammatory metabolites, oxylipins, helping them recover better from this unaccustomed exercise bout. Now, I believe that there is such a strong connection between exercise and the lowered risk for acute respiratory infections. I think it's time that this get recognized better. We have what are called the physical activity guidelines for Americans. This has been copied or used or adapted in many countries around the world, including Brazil. Basically, these guidelines say that adults should move more, sit less throughout the day. Some activities better than nothing, but we're telling people sit less, move more. And the physical activity guidelines for Americans list all of the benefits that come from reduced heart disease, hypertension, diabetes, etc. Notice that the effects on the immune system and lowered risk of infection is not on this list. So much evidence now that moderate activity stimulates the immune system. Here we have a subject walking for 45 minutes on the treadmill. What happens? Immune cells come out of the bone marrow, the spleen, and then return a few hours after the exercise bout. And so exercise stimulates this interaction between the lymphoid tissues. The cells that come out are monocytes, neutrophils, natural killer cells, also killer T cells. And MAC are very important in the upfront defense of our bodies against pathogens. So exercise is stimulating in a training of these cells during something like brisk walking. As this is done day after day, it all adds up to improved protection against infection. Showing that infectious disease incidence and mortality are substantially lower in physically active people. If you look at overall infectious disease, COVID-19, the common cold, viral diseases in general, bacterial diseases, pneumonia, notice the reduction is very substantial in physically active people. Let me just show you a couple studies. This was a study of nearly 98,000 adults in the UK. And the blue bar are groups who are engaging in 150 minutes a week, or the sedentary. So notice that bacterial infections, if we look at the risk, it was knocked in half in the physically active group. Viral infections were down in a half, and pneumonia down about 1/4. This is a study we did of over 1,000 adults who were followed for 12 weeks in the winter and fall. Notice, especially right here, the physical activity fitness level, that the number of days they were sick for 12 weeks was 8.2 if they were basically sedentary. If they just engaged in medium levels or high levels of fitness activities, they knocked that down substantially. In fact, it was a 46% reduction in the number of days of sickness. And this was the #1 lifestyle method for reducing infection risk. Here's another study looking at COVID-19 in Southern California. And the green bar are those who were not doing much activity. The blue bar, some, and then the gold bar, those following the recommended 150 minutes per week of activity. And notice that the odds of ending up in the hospital with COVID, the ICU unit, or dying were substantially reduced in those following the recommended levels of activity. Here's another study, and we're looking at almost 500,000 adults and looking at the combined aerobic muscle strengthening activity. And we're looking at those with insufficient versus those who are meeting all of the activity guidelines. And we're looking at all-cause mortality, 40% down. Cardiovascular disease risk was 50% down. Cancer, 40% down. Diabetes, more than half down. And look at influenza and pneumonia, also about the mortality rates were half reduced. So very strong evidence here that one of the chief benefits of activity is not just chronic disease, but it's also mortality from infectious disease is strongly reduced. So I think it's time to add reduced risk for acute respiratory illness to the exercises medicine list. So we know that COVID, the flu, pneumonia, common cold, they're very pervasive. There's a growing awareness that inactivity is a risk factor for infection. And the linkage has been strengthened during the pandemic because more scientists took a look at this. And the lowered risk is mainly attributed to the fact that every time you exercise, the immune cells start circulating and their surveillance against pathogens is increased. So basically, the immune system needs exercise to do its job better. Here's a study I did with some elderly people. This is a woman. The average age of the women I recruited is 73, and they were all lean, very active individuals. And then I had, here's another subject in the lean, physically active group, and I looked at both infection rates and their immune systems compared to an overweight control group of women in their 70s. So we're talking people in their 70s. The immune system is not so good as we get older. What did it do if you were lean and fit in old age? Here we see that in the highly conditioned older women, they had a 56% higher T cell function compared to the unconditioned women. So, in summary, we all want immune strength. We all want protection against pathogens, especially during these terrible years we've all experienced with the pandemic. Here we have all the various bacteria, viruses that are trying to get into our bodies. We all have an umbrella of protection. And much of the umbrella can be strengthened through regular exercise, weight management, so being lean and fit, having a healthy diet, keeping our stress under control, having adequate sleep and recovery. That will strengthen the umbrella of protection. But if we don't follow these lifestyle habits, then pathogens can more easily get through and then into our bodies where they can cause infection. And so exercise is one very important strategy that we can all use to improve our immunity and protection against pathogens. So thank you very much for your attention today. And this is David Nieman from the Appalachian State University, North Carolina Research Campus in North Carolina.
Ok, retornamos para cá. E realmente um momento muito bom para nós, excelente. Isso vai ser compartilhado com os colegas, vai estar no YouTube. E nós temos a honra de ter conosco o Dr. David Nieman, já está presente. Ele vai ser traduzido pelo doutor, também agradecer ao Dr. Eduardo Bonariuc Fontes. E eu passo agora a palavra para o professor Roberto Jerônimo, que vai mediar esse bate-papo. Os colegas aqui, se quiserem fazer perguntas, fiquem à vontade. Dr. Nieman, thank you.
Boa tarde a todos. Quero também agradecer a presença do Dr. Nieman no nosso evento, o que se torna um divisor de águas nas nossas ações. Bom, nós temos aqui algumas perguntas para iniciar o nosso round de dúvidas. E se vocês tiverem perguntas, também podem se pronunciar, tá? Que a gente vai intercalar entre uma presencial e uma que veio do YouTube. Então, vamos começar com a presencial. O professor Pitanga tem uma pergunta.
Dr. Pitanga.
Boa tarde, Dr. Nieman. Congratulations for your presentation. My question is making in português. O senhor colocou que os diferentes documentos que existem a nível de recomendações e diretrizes para a atividade física não enfatizam a importância do sistema imunológico, assim como são enfatizadas as questões relativas ao sistema cardiovascular, metabólico, saúde mental. Então, esses documentos eles têm sido omissos, tanto os publicados no Brasil, quanto os publicados nos Estados Unidos, quanto em outros países, com relação à importância da atividade física para o fortalecimento do sistema imunológico. O senhor acredita que isso possa ser atribuído a quê? E, além disso, o senhor acha que, com a pandemia Covid-19, provavelmente, em próximos números ou edições desses documentos, o sistema imunológico passará a ser melhor colocado dentro dessas sugestões para a prática da atividade física?
Okay, can you hear me now? No? Hello? Can you hear me? No?
Yes, yes.
Maybe? Oh, perfect. Dr. Nieman, can you hear me? No? He cannot hear me. Ele não consegue me ouvir para fazer a tradução. Pessoal, consegue? Talvez precisa liberar o meu áudio para ele.
Professor, a gente vai tentar aqui solucionar esse problema técnico aqui.
Ok. Just one second.
Ele não está ouvindo o tradutor.
Okay, doctor.
Can you hear me now? Okay.
Do you hear me? Yes. Moment, please.
Hello, Dr. Nieman. I'm glad you spend your time with us today. And my name is Giovanni. Here in Brazil, we have been following an increase in high-intensity exercise modalities, such as CrossFit. So these participants who are already starting this activity without previous physicals or medical assessments, or coming from a sedentary lifestyle. So what's your advice to this professional who do that exercise about the risk of these modalities can bring to its practitioners?
Well, we've conducted randomized trials with sedentary people, and we randomized them to brisk walking, and it was, we started around 30 minutes and built up to 45 minutes of brisk walking 5 days a week for 12, and other studies 15 weeks. So these previously sedentary adults that added physical activity to their lives while the randomized controls did nothing. We showed that infection rates were decreased by 45% over a 12-week period in the winter or the fall. And we showed that these sedentary individuals, when we took them to the lab and looked at their immune cell response to the walking, they had this wonderful influx of immune cells into the circulation during walking. That flux of immune cells continued for about 2 hours after the exercise was over, and then everything was back down to normal. And then they would go out and do it again the next day. And so you have this transient surge of immune cells that occurs. And this happens in either sedentary types that adopt exercise or regular people who are on a regular basis physically active. And that surge of immune cells occurs every time you exercise. It adds up over time to reduce the viral pathogen load in the body, and then the incidence of illness goes down. So I just simply would recommend for previously sedentary people, or I would tell them that brisk walking is a sufficient stimulus to bring all of these immune benefits. You don't need to do anything more beyond that.
Tem outra aqui, se quiser. Vai fazer a tradução depois. Mas, basicamente, ele recomenda exercício de moderada intensidade, né, para aumento das células imunológicas e afins. Basicamente, ele fez a recomendação da atividade moderada, principalmente a caminhada já seria suficiente para esse tipo de exercício. Basicamente é isso. Doctor, I have another question for you. Do you think that our açaí as a Brazilian fruit with a similar color and ingredients of a blueberry could generate similar benefits in our immunity system?
So I know that fruit that grows there is very high in vitamin C, but blueberries have 17 different anthocyanins. And the more we're looking at the various fruits, we have shown that anthocyanin-rich fruit is the best for dampening post-exercise inflammation. We just finished a study with mangoes, and the mangoes did not do it as well as the blueberries. So we're going to keep looking at all of this, but of all the different fruits that we've looked at, and we've done about 5 or 6, blueberries have turned out to knock down oxylipin responses better than any other fruit because of the anthocyanins. And that anthocyanins are found in purple fruits. So I know, because I've been to Brazil several times, I know you have some purple fruits there.
Ele falou realmente que a blueberry tem 17 ingredientes diferentes. Ele fez o estudo com manga e nenhuma outra fruta tem apresentado respostas significativas nessa questão da melhoria do sistema imunológico. Ele sabe que aqui no Brasil tem essas frutas, inclusive açaí, mas ele precisa de mais estudos, na verdade. Alguém tem alguma pergunta que queira fazer para a gente poder fazer essa abreviação?
Uma que veio da
Dá licença, deixa eu só testar aqui se ele está me ouvindo agora. Dr. Nieman, can you hear me now?
Yes.
Oh, perfect. Thank you. Thank you so much. So I just want to come back with the first question that was done by Dr. Pitanga. And so he was asking you about, as you have highlighted, that there's several guidelines around the world, like even in Brazil and the US, that they kind of ignore the aspect of the immunology contribution by that exercise can provide to the immunology. So he was wondering, why do you think people are ignoring or not kind of highlighting that importance, specifically during this time of after COVID with such an important contribution?
Right. I remember when I started all of this back in the early 1980s. At that time, it was actually thought to be almost quackery, this thing that exercise could help the immune system. And so there was a lot of negative responses to the exercise immune studies early on. I had, my most cited paper is the Los Angeles Marathon paper, where we showed that the odds of getting sick after running a marathon were 6 times higher in the runners that ran the race compared to those who didn't. That paper was rejected 4 times by different journals, finally got accepted, and then now it's the most cited paper I have. So it just took a while for this field to develop. It was relatively new compared to like heart disease, and exercise has a long, long history of research behind it. Cancer and exercise, also a long history, but the immune infection response to exercise, it really only got going in the 1980s. And I do believe, though, now that we have enough evidence that hopefully the next time the physical activity guidelines are produced, that they will add this as a benefit. The data are really overwhelming in my viewpoint.
Thank you. Então, o professor Nieman estava comentando que ele acredita que talvez 30 anos atrás, as evidências que mostravam a contribuição da prática de exercício na imunologia, né, no sistema imunológico das pessoas, ainda não estava muito bem estabelecida. E aí, nesse sentido, ele até trouxe um exemplo de um trabalho que ele fez sobre a maratona de Los Angeles. Ele conta que eles identificaram que quem correu a maratona de Los Angeles teve a quantidade de infecções depois da maratona muito aumentada, né? Então, ele ressaltando talvez um efeito até maléfico naquele momento ali pós-maratona. E ele fala que esse trabalho assim criou muita discussão na literatura, porque era uma coisa que as pessoas não estavam esperando, mas aí depois com outros estudos isso foi demonstrado que tem existe uma janela de oportunidades ali que a pessoa fica mais exposta depois da maratona, mas no sentido mais a longo prazo, né, já começa a ter muitas evidências mostrando que, de fato, o exercício contribui muito para o sistema imunológico, e isso vem se tornando cada vez mais evidente em vários trabalhos em outros laboratórios ao redor do mundo, e ele acredita que agora já tem muita evidência que fortalece, e ele sugere fortemente que essa contribuição dos trabalhos dele, inclusive de outros laboratórios também, devem ser considerados na hora de, né, criar essas recomendações nacionais ou internacionais sobre a prática de atividade física no sistema imunológico. Dr. Nieman, another question about in the same topic from Dr. Pitanga. He was asking, how do you see about the contribution actually the influence of COVID into this area, because we know that there's a lot of data showing that COVID was kind of mitigated by the exercise activity or exercise contribution. How do you feel like this can be also a push for these guidelines to be restructured?
Beyond any doubt. I mean, the number of studies, but more than anything was the size of the epidemiological studies that have been published are just wonderful. There's studies with over 100,000 people. And as I showed in my talk, the data are very strong that if you're a lean, fit person, your risk of COVID was very low compared to unfit, obese individuals. So the data are strong. This should push the field into acceptance, I hope, into the new guidelines.
Okay, thank you. Então, o professor Nieman estava comentando que essa contribuição dessa experiência, né, com o Covid impactando aí né, o mundo inteiro. Então, ele mostra que, ele até mostrou na apresentação que tem estudos assim, bastante robustos, né, com mais de 100 mil pessoas sendo avaliadas, e mostrando de fato que pessoas que são magras e que são fisicamente ativas, o risco de infecção ou de severidades causada pela infecção é muito, muito baixo, né? Então, causando uma proteção muito, muito evidente. Então, ele fortalece, ele acredita que, sem dúvida, esse aspecto é uma condição que fortalece ainda mais a inclusão da contribuição do exercício nas condições ou na resposta imunológica desses pacientes, desses praticantes. Agora, acho que agora a gente pode talvez abrir para mais questões do pessoal que está presente.
Professor Eduardo, professor Nieman. Temos aqui duas perguntas que vieram da internet, do YouTube. A primeira é a seguinte: muitos estudos discutem o impacto do exercício aeróbico Oi, nos ouvem?
Sim.
Vamos lá. Muitos estudos discutem o impacto do exercício aeróbio intenso no sistema imunológico. A mesma relação pode ser estendida à musculação?
Okay. So one of the questions that came from the YouTuber, and so he was asking about the contribution of strength training, if that will provide the same benefits when you compare to aerobic exercise. Is that also beneficial for the immunology of the people?
So we and others have looked at strength training, acute bouts, chronic bouts, but way more common have been the studies on walking, jogging, swimming, cycling. We don't have a lot of information to make definitive conclusions, but it appears that because strength training involves a small muscle mass at any given time, that the response of the immune system is not as good with strength training compared to aerobic exercise. When you walk or jog or swim or cycle, you involve a large muscle mass. And we know as the heart rate goes up and stays up, blood pressure is up, blood flow is up, that recruits immune cells into the circulation, and then they roam the body at a higher rate than normal. That does not occur as well with strength training. Strength training there's kind of a limited muscle mass where there's a high intense lifting effort for less than a minute, and then people usually will rest, and then they'll do another set, rest. And so the overall immune response in our hands and the hands of others is not as good as with whole body activity. There are many, many benefits with strength training. The immune benefit is not well studied, not well defined, but what we know thus far is we would say it's not as good as cardiorespiratory activity.
Ok. Então, ele estava comentando que, de fato, tem muito mais estudo com a resposta do exercício aeróbio no sistema imunológico do que a musculação, por exemplo. Ele, inclusive, já fez vários estudos tentando investigar isso, e o que eles encontram é que a contribuição é menor do que o sistema aeróbio, do que o exercício aeróbio. De fato, o exercício de musculação, ele é de alta intensidade, ele tem diversos benefícios, mas parece que quando você compara com o exercício aeróbio, parece que a contribuição do sistema aeróbio do exercício aeróbio é maior do que a musculação. Mas ele acha que isso ainda não é não existe um ponto final. Ele acredita que mais evidências precisam ser coletadas, mais estudos, mas por hora o que se sabe é que de fato o exercício aeróbio parece ser melhor do que o treinamento com pesos, né, a musculação. Mais uma pergunta?
Good afternoon, David Nieman. Nice to meet you. My name is Tamires Cortá. My question in Portuguese. A minha pergunta é sobre alguns estudos que eu tenho acompanhado, que eu estou fazendo doutorado na Universidade Federal de Minas Gerais, na neurociências, e tem se observado uma relação da alteração da microbiota intestinal com o aumento do sedentarismo nas pessoas. Então, dependendo de como está essa alteração na microbiota, a pessoa já tem uma tendência maior a se manter nesse sedentarismo. Então, a gente sabe dessa dificuldade do exercício de alta intensidade, de fazer as pessoas diminuírem, mas a gente sabe também da dificuldade de fazer as pessoas se manterem no exercício físico, começar e se manter. E se essa alteração da microbiota já está ali, ela tem mais dificuldade de começar esse exercício e se manter. E tem a via direta do intestino com o sistema nervoso central, que é o nervo vago, que tem relação com esse sistema autônomo e que é muito relacionado com o exercício físico. Como você falou de algumas inserções aí da alimentação para ajudar no exercício físico, gostaria de saber se você já sabe algum caminho, já viu alguma coisa nos estudos que possa começar com uma alteração alimentar para ajudar a pessoa a se manter ativa, ou algo que seja feito em paralelo para essa alteração da microbiota, para ajudar nessa manutenção desse exercício físico para o sistema imunológico também, né?
Dr. Nieman, so Camila, she's doing her PhD back in Brazil, and she's very interested in this area. So she was highlighting a little bit about the whole microbiota into our lifestyle, this interaction. So she was mentioning how our microbiome has a very close adaptation to how if we are sedentary, for example. And she was asking you if you believe that diet interventions can maybe contribute to change this microbiome into the people's body, specifically in the gut, and if that is possible, to benefit people to exercise more, to keep exercising, to adhere to the exercise program. She's asking if there's something that we can help this adherence to exercise by manipulating the microbiome before the exercise starts.
Well, so we are writing a paper right now where we collected 4 stool samples from 25 athletes over a 10-week period. And we are looking at alpha diversity. I think you know alpha diversity is that there are many different types of bacteria, viruses, fungi, and so that there is a diverse population. And in this paper, we're going to show that the athletes who had the most diverse gut microbiome, that alpha diversity was high, that they had the lowest post-exercise oxylipid inflammation response. And we linked it to one species in particular, and it was the Prevotella capri. And this particular species, if the athlete had a high level of Prevotella capri in their gut, those individuals were the ones that had a high inflammatory response. So what we're showing in this brand new study, it's never been done before, is the gut microbiome has a huge say in the post-exercise inflammation response. Most importantly is alpha diversity. And that is promoted by being fit and thin and eating many different types of fruits and vegetables for the long term. We looked at 4 weeks of cranberry ingestion, and 4 weeks of cranberries wasn't enough to change alpha diversity. It takes months and months. It takes a lifestyle, years and years of lifestyle to mold the gut microbiome. And so if you're a lean, fit person eating lots of fruits and vegetables, you'll have better alpha diversity. And then we just showed is your post-exercise inflammation is reduced. So her question is excellent. It has a huge say, and this is brand new research, and I think it's going to be the future of sports nutrition is molding the gut microbiome so athletes respond better to vigorous exercise.
Bom, Camila, ele exaltou, gostou muito da sua pergunta, ele acha que foi muito interessante. Basicamente, o que ele estava comentando é que ele acredita que sim, né, que a microbiota tem uma contribuição muito importante na resposta inflamatória pós-exercício. Basicamente, o que ele fala é que é a diversidade alfa, né, então, que é a variação das colônias de bactéria dentro do intestino parece ser um fator muito importante. Então, aqueles que são mais fisicamente ativos, aqueles que são mais treinados, parece que tem uma maior diversidade, né, desse sistema da microbiota no intestino. E isso parece que está bem claro nos estudos que ele comentou, né? E o mais importante é que depois, né, quem faz exercício, a resposta imune depois, quanto maior a diversidade, menor a resposta inflamatória pós-exercício. É como se ajudasse ele a estar mais protegido, né? Então, ele exaltou isso. No entanto, ele traz que existe uma espécie específica, né, que ele falou aqui, que é a Prevotella, que parece que é uma colônia específica de bactéria que está associada a maiores respostas inflamatórias pós-exercício. Então, seria um possível alvo para se estudar, né? Então, ela seria uma maléfica, digamos assim. Mas, no final, ele ressalta que eles já tentaram manipular essa diversidade da microbiota com algumas dietas, com frutas, por exemplo, e ele diz que não consegue alterar, que tem que ser uma resposta já a longo prazo, de anos e anos de intervenção, né? Tem que ser algo que tem uma dieta assim estabelecida para conseguir, de fato, modular essa diversidade das bactérias, das colônias de bactérias no intestino. Então, ele acha que isso mas de fato tem bastante influência. Então, ele acredita ele acha que essa resposta, ou atacar, né, essa estrutura da microbiota a longo prazo, é o futuro da nutrição esportiva. Ele acha que é definitivamente muito importante para ser estudado, e é algo que eles estão agora estudando. Ele estava descrevendo um pouco do trabalho que ele fez está fazendo agora, estão escrevendo, que é justamente com atletas, né, monitorando essa resposta da microbiota e vendo essas respostas inflamatórias pós-exercício. Então, isso é um tópico muito recente e que é algo que ele acha que vai se tornar um destaque nos próximos anos, sem dúvida.
Obrigado. Agora eu vou colocar uma pergunta aqui também que veio do YouTube. Pensando em uma população de crianças e adolescentes escolares, qual a recomendação de atividades indicadas e contraindicadas, considerando a particularidade do sistema imunológico dessa população?
So one of the questions now is asking about how the exercise will specifically be beneficial for children in the school age. So do you feel like there's a specific recommendation? Is that something that we can optimize the benefits of exercise for this age range, going to school and every day they're interacting with others and maybe more exposed to other infection possibilities?
So this age group, children, elementary school, high school, has not been studied hardly at all. We don't know. To me, there is every reason to believe that what we have found in adults would apply to children because it's based on the fundamental basic science pathway, which is you exercise, the immune cells circulate, and that improves surveillance against pathogens. So there's every reason to believe, whether you're young or middle-aged or old, that it would apply, but we don't know. We have not studied children enough yet.
Então, a resposta dele, ele acha que, na verdade, não existe nenhum trabalho que estuda isso especificamente. Ele é um possível estudo interessante que pode ser trabalhado nesse sentido, essa população, mas ele acredita que as contribuições que eles têm encontrado, né, na idade adulta, parece já ser suficiente para justificar que isso também vai ocorrer com as crianças, porque é uma resposta básica, né, de aumento da circulação sanguínea, uma resposta imunológica que, obviamente, as crianças também possuem. Então, ele acredita que, certamente, há um grande benefício, mas, de fato, ainda não tem nenhum estudo específico com essa população.
Dr. Nieman, good afternoon. My name is Valdecir Lima. I'm glad with your presence in our conference. By the way, I had the opportunity to read your study, 1994, about a G curve. It's the excellent study, and in my career, the first study about immunology and exercise for me, okay? My question, I will ask in Portuguese. Baseado na curva em J, vou olhar para o rapaz lá, baseado na curva em J, eu tive a oportunidade de alguns trabalhos posteriores, e eu li um trabalho de um pesquisador chamado Christy Malme, que ele indicou a curva em S. A curva em S nada mais é do que as pessoas que treinam de forma intensa, elas, a partir de um período de treinamento, elas diminuiriam a possibilidade de imunossupressão. Então, aquele ponto da curva em J cairia, formando a letra S. Certamente o Dr. Nieman conhece esses estudos. A minha pergunta vai exatamente nesse ponto. Como nós, da educação física, temos uma parcela de população que nós atendemos, que são as pessoas atletas, pessoas que competem, se ele acredita realmente que, após um período de adaptação com o treinamento intenso, essa agressão ao sistema imunológico, essa imunossupressão que o exercício intenso causa, poderia ser minimizada com a adaptação. Essa que é a pergunta. Para saber a opinião dele mesmo.
He was mentioning about the well-known J curve associated to the contribution of exercise and the immune system. And he was highlighting a paper from Dr. Christy Malm that is proposing like more an S curve instead of a J curve. So his question is, how do you see these long-term contributions in the suppression of the immunology in response to exercise? How do you see this when you compare this curve situation that is being proposed in the literature?
Yep, so the J curve basically says that if you engage in recommended amounts of exercise, your infection rates will drop below normal. But if you're an elite athlete that pushes like almost to overtraining, that your risk can go high. The International Olympic Committee has looked at all of the evidence, my evidence, the evidence of others, and accepted the J curve for most people who train either just for fitness or for the Olympics. But they did point out that there is some evidence that some very elite athletes, the high-level elite athletes, are genetically superior such that they can take the high stress of very intense and vigorous exercise workloads, and their immune systems do not respond in a real negative way. And my experience has been, though, that they call it, it's almost like being a survivor, that who rises to the top? The athletes who can take the stress of heavy training better than other athletes and not get sick as much, and their immune systems stay okay. And so there may be that survivor effect that occurs. And you have to be genetically superior, I think, to begin with, to get to that point. And I accept that, but I think it only applies to a very small proportion.
Okay. Então, ele estava descrevendo essa relação da curva em J, né? Então, ele fala que quando você, uma pessoa sedentária, quando ela começa a fazer exercício, né, existe uma supressão do sistema imunológico, você fica mais vulnerável, digamos assim, imediatamente após. E aí, a longo prazo, você vai melhorando isso, né, e vai ficando menos suscetível. Aí ele fala que tem um topo, né, dessa curva, tem onde estão os atletas, né, olímpicos e tal, que fazem uma rotina de treino extremamente intensa, que parecem ter uma maior exposição também a essa condição de supressão, justamente pela carga de treino ser muito alta. Então, eles também ficam mais vulneráveis. Mas, de fato, existe um estudo que ele comentou que parece que existe uma parcela bem pequena da população que são esses atletas, uma parcela desses atletas que são os sobreviventes, né, que ele falou que são os survivors, que são pessoas com condições genéticas bem específicas que recebem altas, né, conseguem fazer altas cargas de treino, mas eles não recebem essa supressão no sistema imunológico, como outros atletas recebem. Eles têm uma condição genética que parece proteger, e aí eles conseguem tolerar maiores cargas de treino, né? Não ficam doentes, não sofrem lesões, e eles conseguem tolerar e continuam evoluindo em função do tempo, né? Mas ele acha que é uma parcela bem pequena ainda da população. Então, assim, ele não comentou muito sobre a curva em S, mas basicamente foi isso que ele falou em referência a essa resposta mais a longo prazo.
Ok. Temos aqui mais uma questão vinda da internet. Considerando...
Não estou conseguindo ouvir, desculpa.
Oi, e agora?
Ouve? Agora sim.
Agora sim. Bom. Então, considerando o que foi apresentado com relação a relação entre sistema imunológico e o exercício físico, entramos aqui numa questão específica de um agravo à saúde, que é o câncer. E aí a pergunta é, com relação à recomendação para o exercício com câncer, e qual a intensidade adequada, já que as variações de intensidade interferem no sistema imunológico.
So the question now is about how exercise can benefit cancer patients. So what will be the recommendation for this specific population? since we all know that exercise intensity can impact largely the immune responses. So what did you suggest?
So there's a researcher in Arizona, Ricky Simpson, who has shown that that during exercise, like if you go for a brisk walk, there are certain types of killer T cells that emerge into the bloodstream that are excellent cancer fighters. And his lab is now actually enriching the blood of people. They exercise, and then they harvest those cancer-fighting cells from the blood, and then are using that for therapy. And so what we do know is that acute exercise recruits cancer-fighting T cells. And that as you do this day after day after day, it adds up to reduce cancer. So we know that physically active people have reduced cancer death rates for about 14 different cancers. This is the latest review paper. And everything with the body is multifactorial. Most reviewers are now recognizing that the exercise immune response is one important factor for the reduced cancer, but there's always many others: the diet, the obesity level, and those sorts of things. But we do believe that exercise recruits, we have evidence it recruits cancer-fighting T cells, and that is one reason cancer is reduced in active people.
Bom, ele começou comentando que existe um pesquisador no Arizona, o professor Rick Simpson, que tem estudado bastante essa temática. E ele fala que, basicamente, com o exercício moderado, de baixa intensidade por esses pacientes, parece recrutar, né, algumas células que ajudam no sistema imunológico, né, que é o T-cells, e parece ser muito importante no combate dessas células cancerígenas, né? Então, basicamente, o que eles estão, esse professor do Arizona, parece que ele coloca as pessoas para fazer exercício, consegue identificar essas células específicas que combatem o câncer, que ajudam a combater o câncer. Eles excluem dessas pessoas essas células e começam a usar essas células, reproduzem essas células no tratamento de outras pessoas ou da própria pessoa. Então, eles estão coletando essas respostas para usar no próprio tratamento dessas pessoas com câncer. Muito interessante a contribuição desse tipo de exercício. E aí ele fala que já está bem demonstrado que o exercício contribui para o tratamento de mais de 14 tipos de cânceres. Obviamente, ele sabe que é uma resposta multifatorial, né? São várias, não é só o exercício, também tem que considerar a questão da dieta, também tem que considerar outros fatores, mas, sem dúvida, cada vez mais tem sido recomendado a utilização do exercício físico na contribuição do combate ao câncer.
Bom, temos aqui, dando sequência, mais algumas questões também da internet. Uma tem a ver com a relação entre sistema imunológico e hormônio. Podemos dizer que os efeitos do exercício físico sobre o sistema imunológico são mediados por hormônios?
So, one of the questions, Professor, is about the hormones. So they're asking if the hormones can somehow mediate the benefits of exercise in the immune system.
Well, so if you do something like a marathon, cortisol is very high, epinephrine is very high, and in that context, the hormones actually are trying to dampen the inflammation response, but also dampen immune activity such that infection rates go up. So in that context, the hormones the stress hormones are acting in a negative way. But then in other situations, for example, when you wake up, cortisol goes up, and this helps to activate the central nervous system, and it also helps to activate the immune system. There's a recent paper out showing that if you have unusually low cortisol levels when you get up in the morning and throughout the morning, that low cortisol was the major risk factor for severe COVID-19. So these stress hormones can act depending on the context in different ways. In a resting state, if your cortisol is too low, you're more prone to COVID-19 because you're not getting that immune bounce. But after a marathon, when the hormones are very, very high, this may be one of the reasons why people get sick after a marathon.
Bom, ele falou que né, tá bem evidente que os hormônios contribuem de diferentes formas para a resposta imunológica, né? Então ele deu o exemplo, por exemplo, quando você corre uma maratona, depois da maratona você tem a resposta do cortisol bastante elevada, e isso, sem dúvida nenhuma, tem uma contribuição, um impacto negativo na resposta imunológica. Por outro lado, ele estava ressaltando a questão, né, da resposta do cortisol quando você está em repouso, né? Então, por exemplo, quando você acorda de manhã, né? Então, parece que existe uma relação inversa da quantidade de cortisol que você tem ao acordar com o seu, como um fator de risco para o COVID, por exemplo. O que ele quer dizer é que é o seguinte: se você está com o seu valor de cortisol muito baixo, quando você acorda, esse é um fator de risco bastante elevado para ter uma resposta severa à infecção do COVID, né? Então, ele acha que em alguns momentos o cortisol, por exemplo, parece atrapalhar a resposta imunológica, né, como essa questão pós-maratona, mas em alguns outros momentos parece, como ao acordar, parece que ele pode ajudar, contribuir para ter um sistema imunológico mais eficiente. Então, ele trouxe essas duas perspectivas em relação aos hormônios e à resposta imunológica.
Dr. Nieman, somente o exercício... primeiro, desculpa, qual a sua opinião sobre o efeito do exercício na melhoria da vacina, né? E mais ainda, né, apenas a atividade física, independentemente da vacina, é suficiente para melhorar o sistema imunológico contra diferentes processos infecciosos?
The first question was, how do you feel about the benefits of exercise in boosting the contributions of the vaccines, the COVID vaccines?
Yep. So really, in the end, there was this theory that if you went for a brisk walk before getting a vaccine, or if you did push-ups or weightlifting and then got the vaccine, that you would have a better antibody response. Those studies have not been consistent, and we now don't accept that anymore. But what we and others have shown is that, for example, there's a researcher, Marion Kohut, from Iowa State University. She took older people and randomized them to 10 months of regular walking and exercise or no exercise, and halfway through the study gave people the flu shot and those who had been exercising on a regular basis had a better antibody response. So the answer is acute exercise before taking a shot, it doesn't help. But if you exercise on a regular basis and are a lean, fit person, you will have a better antibody response than people who are not fit and lean.
Bom, ele comentou sobre duas perspectivas diferentes. A primeira é especificamente o efeito agudo, né? Então, ele falou que existia uma teoria que quando você, se você fizesse exercício imediatamente antes de tomar a vacina, né, ia lá para a musculação, fazer uma caminhada e chegasse lá e tomasse a vacina, existia uma teoria que talvez isso fosse aumentar a quantidade de anticorpos induzidos pela vacina. E aí ele fala que os estudos mostram que, de fato, isso não é verdade, não tem nenhuma comprovação que há uma contribuição aguda do exercício na resposta da vacina. No entanto, ele fala dessa professora, Marian Kohat, da Iowa University, que ela fez um estudo bastante interessante, né? Tinha idosos fazendo exercício por 10 meses, né, de forma bem regular, e um outro grupo que não fazia exercício, e aí no meio da intervenção ela ia lá e dava vacina da gripe nesses dois grupos. E ela mostrou que, de fato, aqueles que faziam exercício regular, eles tinham uma resposta de anticorpo melhor induzida pela vacina. Então, fazer exercício contribuía, assim, para a resposta para a vacina. Ele não comentou em relação específica do COVID.
Apenas a atividade física, independentemente da vacina, na opinião de Dr. Nieman, isso é efetivo para melhorar o sistema imunológico contra diferentes processos infecciosos?
Sim, aí a outra pergunta I'm sorry, the other question was about when you compare the physical activity only contribution to the immune system against COVID, how do you see that when you compare with vaccine contribution? Do you believe that only the exercise is efficient or sufficient to contribute to suppress the COVID response? Yeah.
Yep. So what we do know is that the vaccine has a very strong effect in reducing the severity of the illness. The effect of the vaccine in preventing COVID-19 infection is not as strong. People still tend to get COVID after the vaccine, but it's not as severe. And so early on, there was a lot of hope that the vaccine would prevent the infection altogether, but that didn't work out. It has a small effect in reducing infection rates, but a much bigger effect in reducing the severity. So now when it comes to physical activity, and also being lean, and we usually have those work together, being lean and fit go together, that in those individuals, there is a reduction in infection rates, but also, like the vaccine, even greater effect in reducing the severity of the illness. So they actually work almost the same. But obviously, we're not going to tell people just exercise and don't get the vaccine. 1 + 1 is 2. It's better to do both. And I haven't seen any data to indicate that if you're vaccinated and exercise, that is better than just exercising or just taking the vaccine. But I would guess that there is an additive response.
Bom, ele comentou que, de fato, a vacina ela tem uma contribuição, né, tem sido amplamente demonstrada na redução dos casos severos, né, da mortalidade. Então, isso a vacina tem contribuído bastante. No entanto, era esperado que fosse também contribuir para prevenir, né, espalhar o vírus, né? A prevenção de adquirir o vírus. E isso parece que a vacina não faz. Ou seja, as pessoas continuam sendo infectadas, mas elas estão vacinadas e aí os sintomas são mais moderados, são bem mais tranquilos. Né? Isso é o que a vacina faz. Agora, em relação ao exercício, tem sido bastante demonstrado uma resposta da prevenção. Então, quem faz mais exercício, quem é fisicamente ativo, a quantidade de infecções, né, é menor, assim como também o desenvolvimento dos sintomas. Os sintomas também são menos severos naquelas pessoas que têm a atividade física praticada de forma regular. Então, ele falou que ele acredita que a contribuição do exercício é bastante significativa também, assim como é da vacina, mas não existe um estudo que, né, não deu vacina, né, para conseguir comparar. Então, não consegue ser uma questão uma afirmação definitiva. Mas ele também não acredita que ninguém vai falar para uma pessoa que para não tomar vacina ir lá e fazer exercício, porque ele acredita que, né, nessa condição de saúde pública é importante, na verdade, combinar os dois, né, adicionar os dois para conseguir ter uma resposta imunológica mais forte e conseguir se prevenir e também diminuir essas severidades causadas pela infecção do Covid.
Ok, tem aqui mais duas perguntas. Na verdade, são três, mas duas estão na mesma lógica. E vou fazer em bloco, para a gente poder... A gente também está com o horário um pouco apertado, então essas duas eu vou fazer em bloco. Tá? A primeira é a seguinte, a gente já comentou, né, já foi comentado aqui com relação ao exercício e essa curva imunológica em crianças e adolescentes. Mas a pergunta ela vem com relação à menarca. Qual a sua opinião em relação aos exercícios físicos para meninas antes da menarca? E qual o cuidado em relação a jovens atletas e a intensidade do exercício? Essa é a primeira. A seguinte tem relação com aquele conceito que nós temos do exercício físico, né? A relação volume e intensidade. Então, qual variável tem mais influência para a melhora da resposta do sistema imunológico? O volume ou a intensidade de treino?
So they gave two questions, and I believe they're the last questions. So the first one was associated with young, the response for young females, right? So young girls, before they get the menarche. So do you believe that exercise can somehow affect that specific reaction in the young female girls? And
You mean the age of menarche?
yes.
So, but that's not an immune question, is it?
Yeah, that was just a question that came, I think, from the internet. They were asking if that will somehow impact. Do you think that it's any contribution or something that people could worry about?
Well, we do know, but it's not the immune system, but we do know that thin, active girls have a later age at menarche than sedentary, overweight girls. So that's been shown, but it's not related to the immune system.
Okay.
Yeah.
Então ele tá comentando que não tem relação, né, com o sistema imunológico, né, esse exercício, né, manipulando ou atrasando a resposta da menarca. Ele fala que, de fato, meninas mais jovens, aliás, meninas que fazem exercício, que são magras, elas retardam, né? Elas têm a menarca um pouco mais tarde do que as meninas mais obesas, por exemplo, tá? And now the other question that they came was associated with how we can manipulate exercise to induce or to optimize the benefits into immune system. If you believe that how the intensity or volume of exercise could be manipulated to really get to this optimized response.
So we know that within the first minute of like a brisk walking, immune cells are already coming out. It happens very, very quickly. We've shown it can happen within 45 seconds, that the immune cells, you can already see them coming into the blood. And then as they move through the body, they have a better chance to deal with pathogens that are trying to come in. What this suggests is that, some people will exercise for 45 minutes and then sit for the rest of the day. And what the immune system really wants is activity bouts throughout the day, because it means you get this recruitment every time. So we need to study this better, but it makes sense that it is better to have these exercise bouts spread throughout the day. It can just be walking up the stairs, for 5-10 minutes, or taking just a little walk here and there. But every time, the immune system is activated. So until we know more, I would highly recommend spreading the activity throughout the day. Humans were not meant to sit for hours and hours and hours and then go to the gym and work out for 45 minutes, and then they think it's all okay. We really were meant to spread it out.
Ok. Então, ele comentou nessa relação do volume e intensidade, né, e em relação à resposta do sistema imune. Ele falou que no laboratório dele, eles já demonstraram, por exemplo, que nos primeiros 45 segundos de exercício já é suficiente para aumentar essa resposta imune, e isso parece ser bem evidente. Você começar a fazer uma caminhada leve, isso já ser suficiente para causar esses benefícios, né? E aí só o fato de ter toda a circulação aumentada, isso contribui para acessar esses possíveis patogênios, né, esses vírus ou bactérias que estão presentes no organismo, porque você tem mais sangue circulando ao redor do corpo. Então, isso já é bastante importante. Então, não precisa ser muito intenso, por exemplo, que é o que ele estava falando. Agora, uma coisa que ele chamou bastante atenção ele fala, o ser humano não foi feito para ter ir lá na academia, fazer 45 minutos de exercício muito intenso e depois passar o dia inteiro sentado, né? O nosso corpo não foi feito por isso, para esse tipo de comportamento. Na verdade, ele sugere que espalhe, né, as pequenas tarefas, pequenos momentos de exercício ao longo do dia, né? Então, 5, 10, 15 minutos ao longo do dia espalhados, ele acha que isso, você estimula o sistema e relaxa, estimula, você aumenta essa contribuição para melhorar o sistema imune, induzida pelo exercício.
Ok. Uma última pergunta, Eduardo. Dr. Nieman, o Brasil está entre os 5 países mais sedentários do mundo embora nós tenhamos um clima, um relevo muito favorável para a prática da atividade física, assim como profissionais qualificados para a orientação da atividade. Entretanto, a pandemia do Covid, ela mostrou a importância da atividade física para a promoção da saúde. Na opinião do Dr. Nieman, esse período, a pandemia, o período pós-pandemia, ele vai ser suficiente para fazer com que as pessoas vejam, observem a atividade física, o exercício, de uma maneira diferenciada e positiva?
Dr. Nieman, so they were suggesting, or Brazil actually is well known as a very warm and nice climate, nice weather, but it still is the fifth most sedentary country in the whole world. So he was asking if you believe that after all of this contribution induced by exercise benefits into immune responses, into combating COVID-19 infections, do you believe that that could be something that will really help individuals to change their lifestyle behavior, or could you suggest to use this and to facilitate, to improve people to make more exercise?
You know, when you can tell people, we know if you go for a brisk walk every day, that you will have half the days of sickness compared to if you do no walking at all. That's a powerful benefit. And it's simple to explain. The immune system needs exercise. It just takes 30, 45 minutes of brisk walking, and you'll knock your illness days in half. And COVID-19 will be less severe. So I personally think that is a very strong reason to exercise for most people.
Bom, ele falou que ele acredita que, assim, existe uma recomendação, uma questão bem clara e bem forte, né? Que se você for sair para fazer uma caminhada 30, 40 minutos por dia, né? Pode ser bem leve. Isso vai reduzir pela metade a quantidade de dias que você vai ficar doente pelo COVID-19. Então, ele acha que isso é uma evidência muito forte, né? Você vai ficar metade no hospital, ou metade sofrendo com sintomas, metade do tempo. Então, ele acredita que isso é um argumento muito forte para fortalecer as pessoas a continuar, ou pelo menos a iniciar o programa de atividade física.
Eduardo, só agradecer. Aqui quem fala é o Gilmar. Dr. Nieman, muito obrigado pelo seu carinho, pela sua atenção, pelo seu cuidado, pela sua disponibilidade com o nosso pedido. Eu queria falar em nome de todos os colegas aqui presentes e dos centenas de milhares de profissionais de educação física, dos centenas de milhares de profissionais de educação física pelo Brasil, os colegas aqui que são professores, acadêmicos, muito obrigado pelas suas contribuições, pelas suas colaborações, pela sua inspiração, não só para nós brasileiros, mas para toda a população mundial.
Dr. Nieman, they were just really being thankful and for your care, for your attention, for being available for this moment. I think they're very important. It's several thousand people around Brazil is watching, so it's very useful, and they're very thankful. Thank you.
Yep. Thank you. I was honored to give this lecture. Thank you.
Obrigado, Eduardo. Interrompemos.